Sunny,
Hi.
measles.
Yeah,
It's going about now.
it is.
I had a few questions. I wondered if you could answer them for me.
Yeah, sure.
Um, can you get measles if you're vaccinated?
So the chances of getting, so first of all, the vaccination is really important. It reduces your chances quite significantly. Yes, there is a rare chance that you could get measles, but the symptoms are less likely to be catastrophic. So that's what we worry about with measles. It can lead to severe complications, particularly things like meningitis and deafness, which are obviously very bad things.
Yeah.
So 2 single doses of your MMR can reduce that significantly. And if you do end up getting measles, which is very rare, your symptoms are going to be a lot more manageable.
Good. What does like measles look like exactly?
So usually starts off with a small kind of flat rash, redness on the face. Sometimes you can get runny eyes, conjunctivitis, a high temperature. You can get some spots inside the mouth as well. And then that rash usually spreads across the whole body.
Is it itchy? Because I feel like some patients or mothers will come up to us and say that it looks similar to, let's say, chickenpox. But is it itchy at all?
No, so chickenpox, very kind of characteristic of like blister-filled bubbles all over the body. You can kind of, when you see a chickenpox, you can kind of tell it's a chickenpox.
Yeah.
They are very itchy. Measles, not necessarily always itchy. Though later on, once the measles develop, it can get a bit itchy, which we can then control with kind of antihistamines.
You pretty much see chickenpox mostly starting on around the abdomen area, and it's really, really itchy. Is it contagious, measles?
Yeah, so it's one of the higher contagious kind of diseases out there.
Compared to COVID?
Yeah, so it's 15 times more likely
Really?
to spread. So it's a big problem with children at school, particularly those that are unvaccinated. And then it has a high risk for people that are pregnant, for example, people that are vulnerable to other diseases, so immunocompromised patients. So you're 15 times more likely to get measles through kind of respiratory-borne infection, droplets, so when you sneeze or cough.
Wow.
So yeah.
Okay. So I know it's very important we say that kids need to have, or children need to have their vaccinations. Their first one at like 1 year and then their second one at about 3 years.
Yeah, correct.
Can adults actually get measles?
So adults can get measles. If adults get measles, it's a little bit more worrying than children, particularly if they're not vaccinated. So adults go on to get complications such as what we call encephalitis, which is a swelling in the brain. So that's why it's really important to get those vaccinations as a child.
Okay. And can you get measles twice by any chance?
Very, very unlikely. It can happen, like with anything, but very unlikely. And if you're going to get it the second time, it's going to be a lot milder.
Are you finding that people are missing their MMR vaccines quite often? And what's the situation that you're seeing right now?
Yeah, so we're seeing quite a lot of people that are not taking their routine vaccines, and it might be around kind of being busy. We all live in London, we're quite busy with our work, but it's really important getting those vaccines. It doesn't take long. We've got nursing cover, and lots of your GP practices around London will have nursing cover. Later appointments, even weekends, and we can try and fit you in there. If you've got any questions, so if a patient's got any questions, we invite them to come in and we can have the discussion around the vaccines. And our staff, so the nursing team that give the vaccine, are so good and gentle at giving them that's the kind of things that they do day to day. So they'll take that into consideration, especially if you're worried about needles, etc. And they'll make it as comfortable as possible for your child as well. But it's really important if you feel that you don't have you're not up to date with your vaccines, for example, or if you've got any questions, definitely contact us and then we can work around your needs.
Perfect. Thank you.
Yeah, no worries.